Okay. All right. So we are here with Rufus and Zeynep talking about pelvic issues, problems, pain from the perspective of a female and a male. I'll let these guys introduce themselves. So Zeynep.
Hi, hello. This is Zeynep. I'm a physiotherapist, and it's been 11 years that I'm working clinically, and it's been 6 years I'm working with the pelvic area. And it was actually a coincidence that I started to work with pelvic floor. I went to this course about physiotherapy during pregnancy and after labor. And then there I learned about the pelvic floor, and I came to my clinic to use those knowledge onto my regular orthopedic patients, like people with shoulder pain, knee pain, spine pain, etc. And then I realized that there is a solid direct connection with the pelvic floor dysfunction and orthopedic chronic pain in different areas in the body. And then I started to work more and more on pelvic floor. And then as I digged further, I realized that it comes with the problems with the bladder, with the bowel, and sexual function. And then people started to come for those problems only. So that's kind of my story in 6 years.
Okay. Awesome. Rufus, your experience with the pelvic issues?
Yeah, it's hard to place a really clear timeline on it, but as I outlined to Chris in some of our earlier conversations, I've been working on a fishing boat for the past 3 years-ish, and I had one particular injury. I fell on my left ischial tuberosity from the boat rolled and I went sideways and landed full weight on the corner of a box, very hard on that bone. And that trauma prompted some exploration. And I had been working with a yoga teacher and massage therapist who had some familiarity with kinetic myofascial integration. And there was some conversation around that. She directed me to a book by R. Louis Schultz, The Complete Male Pelvis Out in the Open. And I used it, and it was a good sort of starting point. But in a lot of ways, from the connections that you're talking about, Zeynep, the integration of the pelvic floor work to the orthopedic work has been experientially what I've been most interested in. And finding it through that exploration, and then some other online research, finding it to be very helpful in a practical standpoint. But there's no professionals in the area who do any work with male pelvic floor. There's some pelvic floor PT about 3 hours from me that works with women. But the closest person that I've been able to find that does that work is in Baltimore. So quite a ways away from me where I am in Maine. Yeah, and I don't know, I'm just interested in talking to someone who's maybe more familiar and curious about your breakdown of practice, if you're working primarily with female patients, differences you see. Where I start to think and get curious about it is in the orthopedic connections, thinking maybe there's a bit more similarity than is sometimes talked about, but also not really, I'm not an expert one bit. I'm just curious and trying to solve my own injury, and also know experientially that for a lot of peers, this can be a really, really it can be an area that's laden with a lot of trauma and embodied fear and unease, as much socially as physically, I think.
So you're experiencing that, the things that you just said about.
Yeah, I mean, it's all bound up together, and I guess the excitement has been in addressing this from an adaptive, individual, inventive place, has been a way to ease some of that unease, I guess.
Okay, so yeah, I'm working with both male and female. And as far as I can see, I have a totally different approach in both ways, because the pelvic PT is quite famous now, but they really only work in like pelvis like this, so that I'm not doing that. So it's a bit of a difference for me now. But do you mind if we then discuss about your complaints and then go from there?
Yeah, sure. So what happened for me that I described was first and foremost that catalytic injury, the fall. And when it initially happened, I shared with Chris about it. I felt like I didn't think I was going to be standing up when I first fell. I was like, oh, this is bad. And I managed to get up and finish the workday, and there was some predictable like swelling, contusion, like deep purple, and the awkwardness of trying to investigate using mirrors and cameras and things. And it gradually went, like it mostly went away by itself over time through use. But some months later, I was going to be fishing again in the season, and it was still more painful than I thought it should be. And what it was kind of like radiating down through the hamstrings and then also up into I felt it sort of spiraling across. And it's hard for me to place what is this. I've got a pretty good anatomical awareness, but like spiraling up through the opposite side in the front, and then also down a little bit, tension into the testicles. And it was all it felt all related and connected, and I didn't know really how to approach, but then started doing some research and found some protocols for doing internal palpation that felt useful. And that was but it felt very, I think similarly, like instead of this approach and the like zeroing in, I started making more progress when I worked a little bit more globally and was sometimes incorporating that internal touch or external palpation with more movement protocols, and say, like, not protocols, like I'm being fancier than I actually was. It's just like, okay, what if I touch here and move like that and try this trigger point idea, and now I try out my gait and see how that works, but very, very loose, I guess.
Okay, so when was your initial injury?
About 3 years ago. It was in November 2017.
Okay.
No, November 2018. I'm sorry, 2 years ago.
2 years ago. Okay.
Yeah.
So first, obviously, there was pain and so on. Mm-hmm. So the pain you're experiencing now, is it different than the pain you experienced before?
Yeah, I mean, it's more spot specific. Like at first it was kind of just I don't know how to describe it. When I have an impact like that, it feels like the whole, like, I think of it as the fascia, but like all the connective tissue sort of tightening together, and like the mobility in the back was a bit reduced, and that's gone. It's not, I've done a lot of work with it, but there's still sort of a point specific, like it's a place that I notice if tension is coming into the body, whether from like an emotional place or a physical standing place, that'll be a locus immediately, all the time. So that's like, and I can notice it sort of like tightening throughout the day and trying to ease it. And I've got an idea of like how to work with it, but it's still the sort of same pattern. I'm stuck in the same, like,
Okay, so you release it. So this, it's the hamstring, groin, and testicles.
Mm-hmm.
Okay, so you do some things, and then you get a relief, and then when you move during the day, and then it gets worse.
Mm-hmm.
Is it?
Yeah, accurate. I mean, it's not a major complaint now, but it is present, and it's, yeah.
Okay, so do you have any night pain?
Any night pain? Not that I noticed. Not in relation. Well, I mean, if we're
You
looking in
would
the
not.
global sense, what's that?
You would notice if you had a night pain.
Okay, yeah, no.
No, it's good. Sounds like when you like get a trauma like this, a direct trauma, uh, as a normal response, the muscles around that tissue gets stiff.
Uh-huh.
And then we expect them to be released again when the tissue is healed, but that's not the case all the time. So it sounds like your pelvic floor developed some trigger points and probably got tense and got a habit of it. So that's why you cannot get out of that loop. To work that is that there are some specific not exactly exercises, but more like, let's say, practices. Like you start with breathing exercises, and then what breathing does is actually natural breathing, and especially the focus on exhalation kind of calls back the natural movement pattern of the pelvic floor.
Mm-hmm.
That's what I realized over the years, because I tried everything, like every possible technique and exercise out there, and finally I realized that nothing specifically targets the pelvic floor, like squeeze and relax, lift and drop, etc. Those kinds of things doesn't work, at least doesn't transfer to the function. That's
Right.
what I realized. So you get a relief, but then when you start to move in daily life, you get the symptoms back.
Right.
Really quickly, you yourself have experienced pelvic issues, which is on top of your learning of this.
Yeah, I have a quite unique story myself, but do you want me to go into that right now?
It might be a nice kind of tie-in, just because again we're looking at this scientific, professional, and then this experiential. But I think it's wildly important that this scientist, this professional, also has this experiential, like means in which they put all this together, right? Because you feel it for yourself. So if you're willing, I think that would be a really quick, a nice touch to how you put this together.
Sure. So my problem was actually chronic pelvic pain. So it started about when I was 19. And one day I had this pain on my left side going all the way down to my leg, to my foot. And I just had to lie down. I couldn't do anything. That was the starting. And then that pain started to like come back to me in every couple of months. And then well, I lived with it for I don't know, like 8-10 years or something. And then when I learned about this pelvic floor and all this fascia and the whole body connections, etc., I realized that I had a appendectomy when I was 7 years old, and I have a huge scar because of that, because my appendix was exploded before they took it out. So there was a lot of infection, and then they needed to put some tubes in to get out the infection, etc. It was a complex surgery, and I was 7 years old, and it's on the right side of my stomach. So I feel and I assume that there are lots of how do you say it, like adhesions probably in my right stomach. So I realized that it creates a pull from the left side, and that's what I feel exactly. I feel like something is holding in me, you know, and it's pulling my left side, and it's my whole left leg and left side of my stomach kind of is under tension.
Yeah.
So I realized that, and then when I realized it, and with these breathing exercises, and to be honest, I'm not doing this practices too much, but I realized that just even to realize it and just to get to knowledge helped.
Yeah.
And yeah, it's amazing. So as I started to respect to that pattern, that I don't force myself into whatever I'm doing, I'm being aware of my breathing. If I'm holding my breath or if I'm squeezing my stomach, I don't go into that movement so much. So as I pull back from those things that kind of like put extra load on my body, and then I think for 3 years I didn't have that pain at all.
Great.
Yeah, not like this. I have a little bit of discomfort. Sometimes I feel like, okay, my left leg is there, that kind of feeling.
Yeah.
But yeah. But other than that, yeah, it's there. It's and it's different than if it's different from the right side. But other than that, most of the time, I feel okay. And it was like a process of a couple of years. So it helped. So that was my experience. So that kind of like, and every patient that I've seen with chronic problems, the main problem is that there has been too much intervention passed in the day. Like too much intervention. And too much intervention, I realized that it kind of blocks the healing process itself. It's just, you just don't let the body find its ideal, natural, like patterns and thingy for himself, but interventions are like, no.
Yeah.
Doesn't
help. Yeah. That maps really neatly onto my, I don't know, what I've been finding as well. I guess similarly, I'm forgetting who it was that I was reading about, as you were saying, like the pelvic floor exercise in terms of like squeeze, release, etc. And then someone was pushing back on that a little bit and being like, yeah, but what if your issue is you don't know like how to relax it or how to release it? And that similarly, I've been finding that the like more global movement pattern based things and bringing that just awareness, certainly the knowledge helped, of like, oh, this could be part of what I'm experiencing. And some of like what I've been sharing with Chris is there's been a lot of postural shift as I've continued the work of fishing, just kind of out of necessity. It's a very moving, like the environment is moving all the time, and you can either lean against something and sort of fix your position and build in a dysfunction maybe, or try to keep yourself free. And as I've like kept myself free, I've felt myself straightening up and straightening up and straightening up. And that actually has been playing in a lot with what I was feeling in the pelvic world as well. Yeah, but that pattern too that you're saying of like, it was pretty constant, and now that's a great word for it. Like, it's there. Yeah, I know it's there. But it's like, it's there in the way that like, oh, I sprained my sternum a while back, and it's not like a constant thing, but sometimes on that deep inhalation, oh, it's there. Hi there. Yeah. But the breathing piece is really interesting, because I'm definitely someone who wants to like, oh, I'm going to figure this out. And that counsel to like, actually like, don't intervene quite so much and like focus on the simpler thing is really hard for me sometimes. It's like,
I know.
Just like, oh, my job is to relax right now.
And sit back. It's just, I know, like the most common problem that I come across with my patients is that they can't stop. They can't just, be okay with the idea of, okay, you're just going to be doing this breathing exercise for the next couple of weeks and that's it.
Mm-hmm.
And that's too hard for most people.
Yeah, but it has a lot of payoff. It does.
It does pay off. Like if you just can just let it be. And this another option is that it's hard for everyone to just sit back and watch your breathing. It's hard. It's psychologically hard. But the idea is that it's about your attitude. Okay, so when you lie back and you're trying to do the breathing exercise, and if you're feeling like you're uncomfortable or you're getting angry at yourself because you think that you cannot do it, just stop and leave it, let it be. You don't have to do it, you don't have to go through it. Just okay, it's okay, and try it in the next day. And if you're still getting angry and if you're feeling uncomfortable, just stop. Stop. And believe me, like last week, one of my patients, she had a hernia in her stomach, and then she said she was having really hard time with these exercises. And I kept telling her that, okay, you don't have to do it. Okay, you don't have to do it. And like she texted me and she says that, you know what, Zeynep, I feel like so comfortable and my pain is gone and my stomach is so comfortable, but I haven't been doing the exercises for 10 days. Because, but I feel better, like I've done it twice a day. No, it's not about doing the exercise, but
Right.
it's about like letting it be.
Yeah, that's definitely been true for me in ever since like working with that same yoga teacher I was talking about. I don't know, that was a big invitation from her, was the invitation to, like, in the space of this breath, the thing that you like have been holding on to might go away, and like, wouldn't that be awesome? And don't worry about it if it happens. Like, be excited about it. Yeah, that's a tough. What strategies do you use to try to like coach people around that?
Well, what I do is that I have this, I'm also a yoga teacher. So there's this moon salutation cycle. It's really basic and really easy. So what I do is that I break down that cycle. And then before that, I start with just the breathing exercise. It's a simple breathing exercise. You just follow the breath. And then when you feel ready, you start to add on the exhalation. But while you're adding those exhalations, while you're getting your exhalations longer and longer, you shouldn't be feeling any contraction or like pressure in the body. Okay, so and you work on that for about a week or two, and then I use this neurodevelopmental stages when we all learned how to move when we were a baby. So I add rolling into that breathing pattern. They start on supine, and then they started to move their legs and their pelvis, and then they start to roll from side to side and all the way down to prone and then supine, and then they start to go up on in sitting. And then when they start to do that naturally, I took them on all fours, on toddlers, and then we start to work on toddlers, like moving the spine and then moving the hips and the shoulders, like moving with the whole body. And then we carry that on when your knees on the floor, and then your knees start to come off of from the floor, you're going up into the downward dogs, and then you're making your way up into standing, so to speak. But the thing is not about doing the movements, but the idea is you always watching how you're doing the movements. Is your breathing relaxed? Is your stomach relaxed? And do you feel like at ease and comfortable? There's no load in your limbs or anywhere in the body, so to speak, and you're just comfortably doing all of these movements, and that's the idea. And you can lie down and you feel like your body is like glued onto the floor and there's no movement coming out. But then one day you can just lie down and you might do the movements that you would never even think about, like you could do, you know. And where it comes from is that if you just, you know, if you can just be patient and let the body to be, no, it doesn't mean that if you move more, you get much better. There's no correlation between that. I mean, because like every day is different. There might be some things going on in your life. You might be worn out because of some sort of new things that you've been trying out, or maybe you didn't eat well lately, or you didn't drink enough water, or you couldn't get enough sleep. All these things create a capacity for your body, and that's going to change every day, every moment. And the idea is that just in any given moment, can you like read the signals from your body and understand its limits and react accordingly. That's the whole idea.
I wonder with this concept of understanding and feeling the nuance. Like there's a few things there. Like, is it a skill that people just don't find value in? Is it too slow, not intense? Do they know where to put their attention? And the other half, if you think about it, with pain, and particularly pelvic pain, where there may be some shame or something around it, that in order to get by since it started, because they don't see you right away, that's not how people work. They don't like, oh, there's an issue, I need to call help. They like let the issue fester until right, it becomes this magnifying effect. So I almost wonder, and both of you kind of addressing this too, that was there a practice of not paying attention, of avoidance, of distraction that got them through? And then they come see a professional who is saying cause and effect as if their body was like a leaky faucet and that there was only one way to do it and all they need to do is do it and they'd be fine. So the recognition of all these parts and stuff, do you find that people that come to you or that you've experienced have to, when you said they can't just do the breathing, is it because the breathing is so small, because they don't know how to pay attention in all the different ways that they could, that they're used to not paying attention, that they feel like it's that there's no way this little thing can help them? What's kind of been your experience?
That's exactly why I'm training in psychotherapy. So it doesn't happen. It doesn't come out of nowhere. You know, there's certainly a ground that was building up most of the time from childhood, and it's initially it's behavioral, it's psychological, you know, because these things that the doing mind, the controlling, you know, those kind of behavioral, psychological characteristics of people kind of lead them to this road and lead them to this problem. I mean, Rufus, it's unfortunate for you to fall down. That's, you know, that's a whole different thing. But with chronic pain, yes, pelvic, especially if it's related to pelvic floor dysfunction and problems, it's all the time is related to psychological and behavioral characteristics of the patient. So where I, I teach them the exercise. They do understand. They know what they need to do. But at some point on the path, they are distracted by these old behavioral and psychological problems with anger, with wanting to control, cannot let go. And, I see it in their body. They cannot let go. I see it, it's like,
Yeah.
it's so visual, it's visible. Like, I mean, it's amazing, really.
Yeah.
And I was curious, when you see that, do they say, are they like kidding themselves as you're watching? Like, I got it, I'm doing it. And you're like, you're not doing, like, is there them convincing themselves as far as control that they are letting go, that they're doing what you're asking, and you have to like let them know that that's actually not letting go? That's pretending?
Yeah, one thing is that I try not to give feedback too much. I'm not trying to, like, you know what, you're too controlling, you're like this, you're like that, I try not to do it. What I'm using is more like do you realize, like, I see something like this, do you realize it, like, I'm kind of trying to push them to say it or realize it. And if they don't, I don't say anything, really. I'm just trying to, like, and through movement, they can actually say it out loud. And like, they say it, like, they say things like, you know what, I feel like this connection between my head and my body. I don't feel anything what's going on in my body. They actually have this notion, they tell me that, like, there's I've been cut from here and I have nothing coming down. And then when they are moving, we are talking about the quality of the movement. And usually when there's a pelvic floor dysfunction, the movement is so, like, cranky, not flowing. It's, the muscles are working too much, and it's not flowing and it's not natural. And I talk about it, and I ask first, like, how do you feel when you do this? Like, do you feel anything specific? And they tell me, and then I comment, you know what I see is that your leg is a bit moving, like like stop and move. And then, do you feel that? And they were like, yeah, and let's try not to do it, like, do you think you can just let it be? There's this moment of the movement starts and ends. Let's try if you can catch that range, like, so it kind of goes like this, more like an inquiry rather than explaining them what's going on and trying to pursue them to do something. I'm more like, working on in the process. And then if they and I believe, like, people find me when they are kind of like ready for something, ready for change or whatever. And if they are not ready, they don't follow up. They don't come to the second session.
Mm-hmm.
Yeah.
That, I mean, I that was a question direct, but just tagging off of it in the pieces of the, like, why not some of the exercises, like we were talking about the developmental movement patterns, and that was another, like, this has been a very collaged approach, I guess, for me, of, like, sometimes there's a book in the used bookstore and I'm like, oh, that looks exciting. That's where I found a book about developmental movement patterns that were like, oh, okay, it broke down, like, the crawling patterns for me, and it was like, oh, what if I go through these? oh, when I try to lift that leg, it's like, yeah, no connection between head and leg. And I think when you're doing those kinds of things and aware that like, oh, this is a baby pattern, right? And here I am, a 30-year-old person being like, I can't, you're like, oh, right, exactly. And trying to, but like, that's, I think for a lot of people who are like, don't tell me how to move. I've been moving my whole life. Like, I know what I'm doing. And then you're like, yeah, but if you're having this problem, like, and that, like, one, I remember having an aha kind of moment with this issue, where like getting to a deep flat-footed squat has always been a pattern for me. Like I've kept it, but I started to realize like, oh, while I can go down here, I wasn't actually exploring a whole lot of range in that, and was like, oh, I'm like settling into where like this knee wants to hang out like this, and this one is kind of out that way, and like it's my squat, there we go. But functionally it was like, oh, then I'm trying to like lift and everything's going all over the place. And slowly working on that, in part from an invitation from another Think Movement person. I think it was Jen Pilati. Yeah, that was talking about like, well, just like the invitation, like you were saying, to like, what can we do while we're down here? Like, what if I investigate my toes while I'm down here? And those kind of like clues that like, it almost feels like trickery, sort of what, you don't sound like you're tricking people, but the questions of like, what if we pay attention to this to get this effect over here? It definitely feels like an art, what you're practicing, sort of in addition to a science, I guess.
I guess so.
Well, working with people, I would concur.
Yeah.
You have to like, especially in this professional setting, with the trying to make the unconscious conscious and then adjusted, with the idea of people coming to you in like a groinal area, which tends to be already like, oh, I don't know if I can talk about this and it's this bad. Yeah, it's the idea that you're letting them come to their own conclusions. You're just like pointing in a place and then stepping back and letting them, how much can they talk about it? How detailed can they be?
How detailed and how curious can you be? Yeah. I think like that's something, another part of this was starting to do and explore a lot more like palpation of my own viscera. And it was, I mean, talk about a weird feeling. Like, am I supposed to be pressing on this organ like this, right? And being like, what is that effect? And getting interesting effects, but then talking with someone else who's experiencing something similar, right? And here we are both in a world of like not a whole lot of professional help. So it's kind of peer-to-peer sharing sometimes, and being like, well, what if you just press on that rib? And be like, I'm not touching my stomach. Like, no, not a chance in anything. Being like, oh, okay, like, all right. Like, I don't know what to, just a little, like, can you rest your hand on it maybe? But I think that's something that's, especially talking with Chris, has made me soften so much on like how heavy a lot of this stuff is. Like, I don't know when someone's first talking to me about like, oh, I'm having this weird feeling. I don't know what it's coming from. I don't know what it's attached to. And that lifelong thing that you mentioned too, of the kind of coaching that we might be getting to like, you don't touch yourself like that or there or whatever, whether it's from parenting or school or just your own idea. Like, yeah.
I guess it's all.
Yeah, right?
Yeah, it's all. It starts from the family, from your childhood, and then that's what you learn from the school. The whole system is kind of like built up on the idea of doing, that we can control things, that we need to do something to get something, but the nature doesn't work like that. It's just, it has its own agenda, and it doesn't care. So you just okay, of course it doesn't mean that you shouldn't be doing anything. Of course you do some things, but you need to know when you're doing things that you're not in control, and you need to adjust and like adapt when the time comes. You need
Yeah.
to be ready to change something, let go of things, and like things like that. Other than that, if you're like trying to control everything and like hold on to everything, and well, nothing good comes out of that, really.
Yeah.
I wonder, Zainab, between your male and female patients, do you see different tendencies in the genders?
No. Only difference that I see is that men are more shy about talking about these things and asking for help.
Female or just in general?
Again?
Do you think that's because you're female, like you're a woman and they're a man? Like it's
No, in general, because I'm saying this according to the literature, actually. In research, it seems like there are less men affected from pelvic floor dysfunction and these problems than women. But then in practice, it's about the same. So at some point I started to think about that, okay, men are not willing to talk about it, not looking for help, and that might be the problem, that the percentages are like, seems like they're different. And another problem is that like the doctors are not aware of these pelvic floor dysfunction thing. So when male patients usually go to the urologists, and the doctors tend to fix the problem with medication or surgery, or like with biological interventions. And so that kind of creates a pattern that men kind of like live with it until the age of like 50 plus, and then they get a prostate problems, and then they get surgery eventually anyways. So there's this thing called benign prostate hyperplasia. I'm quite confident that it's a result of lifelong pelvic floor dysfunction.
Yeah.
I mean, there's no research behind it, but when you think about it, I mean, like, why would a tissue with hyperplasia? Because because there's too much load on it, and the prostate is partly responsible from urination, restricting the urination. So it must be compensating for something. What can it be compensating about? Well, probably pelvic floor muscles. So, like, I think this is the basic problem. So male, I think they have the problem about equally with women, but they kind of like cannot reach out to the real help. And the male patients that I see, they don't come to me with pelvic complaints. They come to me with low back pain, neck pain, shoulder pain, etc. And then we see that, okay, there is a problem with the pelvic floor.
Yeah. I mean, it all corroborates with my experience and conversation with others, and I think that's the, like, I think about the cartoon to me of, gosh, like, man after man in my life, there's the joke about going to the proctologist, right, when they get to that age that they need the prostate exam. And there is the, like, that to me also, the, like, the level of nervousness and like joking that goes alongside it seems to suggest to me a level of discomfort that's like, oh, this has been a lifelong thing. And like, how to, I don't know, it is a question to me of just like how to normalize that kind of conversation. But it's like, it's so laden with what, like, why would you be going and talking to this doctor about this problem with your groin, and being like, I don't know, maybe I have pain. Like, it's and that's, yeah, but it's so off the topic. Like, there was someone who I knew who had a hernia and was describing like what they were up to and how the doctor had recommended, like, oh yeah, like you're going to have your surgery and then you like don't ever move and don't ever lift anything like that again. And don't ever like, and you're like, oh, so like become a rigid, like, okay, good luck. Like, and that's, I don't know. It's, that is the movement is not the first thing to suggest, very often here. I mean, and I had that, like you're saying, presenting with shoulder pain, right? That's the reason that I went back to a physiotherapist here, was I was starting to have more shoulder pain and hands were falling asleep from the fishing work, and like just faster than I had wanted to. I used to do construction. It used to be a problem. When I went and talked to, what's that?
After the injury.
No, different category, but like the two kind of related. But the point being that in the conversation, when I had first had shoulder pain doing construction, I went to a doctor and their response was, well, the human body's not designed for overhead work. You just don't do it. And it's like, okay, like, I guess I'll just keep doing this job that's going to hurt me. But then finally I find the physical therapist who's like, okay, we can do these exercises and like, this will help. And that, I don't know, that's, I guess, the baffling part, that you seem to be very much like, what is the problem? Let's ask questions about it. Probably we can do something, and meeting with the, like, maybe we can ask a question and like reveal something more about the problem is so different than the hard-edged, like, nope, don't move, put it in a splint. Like, the number of other fishermen that I know that have been complaining about wrist pain, and they've gone to the doctor and the answer has been either here's an opioid or here is a splint. Like, wear this splint at night and keep it immobilized, and then wake up in the morning and go back to work. And being like, I don't know how it's going to help, but you can try it. But it's the, like,
Weird.
So I guess what I'm trying to say is getting to this kind of openness in conversation with peers, like worker peers, can be quite difficult. Is like, that's not what the doctor said. That's not what the doctor said. That's not, the doctor said don't move. You're like, is it working? Is it working for you? Like, is it helping?
Yeah, and it's such a strange thing to, again, the hierarchy of authority in the medical professionals, how, like you said, like, they don't look at this. And when you think, well, what is the thing that people do every single day, all the time? They breathe and they move. And for so much of that medical authority to just dismiss these processes for these protocols. And, you think of all the countless numbers of people who have issues and who have been told, and they don't know any better, and they don't know, right? They don't know people who ask these questions. They don't know, right? So it's one of these, and part of me is like, well, how do we get the medical professionals to take on this sort of, maybe you're wrong, maybe there's a bigger system at play. And it's almost like, I don't know if that battle is ours to fight, right? Like, how would you even, other than being Zeynep and within the system, becoming a medical professional and being that one that asks the questions, and you're not alone, which is great, but I still think in a large picture, especially with insurance and who you're allowed to see, you're by far outnumbered by the X equals Y, and that's it. And the same with you, like your experience, Rufus, like, just stop using it. How is that a solution?
It's just, these are the questions that I always have, and I'll probably, they're not going to go away. They're like the ultimate questions. And you know what? You cannot believe how many malpractices that I've seen. And they hurt people, people suffer from it. Like, with my minor problems that can be solved with really, like basic things, they do things that I don't even like understand how they come up with. And there isn't even a single research in the literature that supports that it's actually treating anything. And then right before before this one, I've seen a man get a surgery for lumbar hernia, and excuse my language, but they fucked him up. Yeah, I mean, it's like they did a surgery on him twice in a month. Like, you cannot do it. Like, I mean, like, it's 6 to 8 weeks for a tissue to heal, and it's going to at least double when we're talking about the low back. So, like, you cannot do it. You cannot decide anything before the tissue heals. Like, there's when there's this one surgery, and then you're doing the second one. And then they gave him complaints that there wasn't there before the surgery. That the initial complaint didn't go away, and they have now additional complaints, and it's one leg is numb. It's serious. And then there's another guy that I've seen that they gave him a hernia surgery for just because he has a little bit of like tingling in the foot, and then they gave him a surgery and he couldn't walk for 3 months, and then couldn't pee, and then they sent him to urologist, and then they did a prostate surgery to him, and then now he cannot defecate. Like, these are serious malpractices.
Yeah.
And these people have no idea, right? What they blame themselves and their body and their failing, right?
They have no clue, and no one is taking responsibility. Says that just give it some time, it's gonna go away, you know, like.
Yeah. I think that's the face that I make too when I've heard so many stories about cesarean sections, and like slightly different than just the pelvic specifically, but the story being, oh, it's just a C-section. It's like, I don't know, you cut through a lot of tissue, and the healing process and the ranges of experiences that I've heard have been quite different. So then when I hear someone being like, oh yeah, it's no big deal, I'm just getting like, why? Like, oh, because the doctor said so. Like, you're like, okay, all right, good luck. Yeah.
I'm not like all against surgery, of course. If you're in an accident and you cut through some veins, right, that's awesome. That's gonna save your
right,
life.
Right.
Or like if you're going into labor and like if the baby or your life is in danger, C-section is awesome. You should do it. Of course, it's gonna save lives. No questions. But then like for a groin pain or for like just a little bit of tingling in the foot that doesn't actually, like you don't even know why, first of all. And then it's not gonna do any harm if it just stays there for a little longer until you figure it out why it's happening, or maybe try some other solutions. And the price, the risk that you take with, like doing the surgery is just way over from the benefit.
Yeah.
I wonder, as we're kind of coming up, and again, this has been fantastic, and I definitely want to get you back, Zeynep, with Savink to talk about like that pregnancy connection. But I wonder, just since we have the both of you, Rufus, do you have any other like questions specifically for her that you might want?
Right. Not at the moment. I mean, my head is going in a lot of directions, and I'm thinking about my own sort of work with myself, and that invitation to stick with the like simpler, and the power of that. The voice. You've done the opposite of giving like stamp of approval from someone with like doctor authority to like, no, take it easy. Don't worry so much about it, which is useful. So yeah, I'll think about it, and if I have other questions, I'll certainly reach out. But no, I feel like this gave me like, yeah, you're doing a good job for yourself, and if you're like reducing your pain symptoms and like having more function, then keep going.
That's
The hardest thing to be given permission.
What I can suggest here is that you try it for yourself, and then like I'm using this voice recordings, you know, like when I teach them, I give this voice recordings to people so that they can do it at home by themselves. So I have the voice recordings also in English. So if you want to give them a try, I can send you the voice recordings. If you,
Yeah, sure. Absolutely.
Super cool.
Thank you.
Fantastic. Always a pleasure. I always learn from talking with everybody, but there's something about having, you know, a professional doctor on the panel that's just like, yes, like that's like, why is it so rare? But we shall all talk again. I know. Thank you guys again for your time, and we'll chat with everybody soon.
Thank you.
Thank you, Zainab. Nice to meet you. Take care,
Nice
Chris.
to meet you. Bye.